no one in this family is vaccinated.
No one. Parents, children, all vaccine free.
Uh-huh. And why have you made the decision?
Well, our decision started a long time ago with our parents. I had amazing parents that researched everything pertaining to raising us children. I'm the oldest of 5. So in the 1970s, they began studying and reading whatever was available back then. And by 1980, when I was born, they decided that I wouldn't have any vaccines. And so then, as a physician in school, I had the opportunity to take immunology courses and do more research. And since then, I've read dozens, hundreds, possibly even thousands of peer-reviewed articles pertaining to vaccination and the immune system. And the more that I read, the more that I'm completely convinced that God created the human body with an adequate immune system that develops in a very particular way. And when we interfere with the immune system with vaccines, there are always consequences. Think about it. We have the most aggressive vaccine schedule in the world. We also have the most intensive pediatric healthcare system with babies receiving vaccines at birth and then every 2 months. Basically, a lot of vaccines, 38 by the time they're 2 years old. And if all of this is being done to keep our children alive and well, it's failing miserably. There was a study published in 2011 showing that statistically over 54% of American children either have a chronic illness, are obese, or have a developmental delay. And so I think we really need to take a long, hard look at how we're treating pediatric health care because the outcomes are not good. And then we also have leading rates of infant mortality.
But when you look at, but that's one study, and some of those outcomes have little to do with some of the chronic diseases and some of the diseases that children are vaccinated against.
And that wasn't looking at infectious illness, it was just looking at the state of our health care. And it was
Right.
a large study conducted by our government of 82,000 American parents.
So, but in terms of the vaccines are what we're talking about. So that really doesn't have anything to do with the vaccines.
Well, based on my research, and a lot of experts are saying that vaccines and the fact that we're giving so many children so many vaccines at a young age is leading to complications in health, in their health later on, leading to serious disorders and chronic disease. So we're trading short-term infectious illness for long-term chronic disease. And of course, natural immunity gives lifelong immunity. Vaccines don't do anything of the sort. And so just to give an example, my family, my parents were the first to not vaccinate me. My mother is one of 11 children. So since she began that trend, we have a lot of unvaccinated people in my family. In fact, we have 48 unvaccinated under the age of 34 and 38 under the age of 16. So statistically speaking, if 54% of children basically have chronic illness, obesity, or developmental delay, almost 21 of my family members should have something along the lines of diabetes, asthma, eczema, ADD, autism, dyslexia, seizure disorder, chronic ear infections, and remarkably, we don't have a single case of anything I just mentioned. No tubes in the ears, no removing tonsils, and it's not just a coincidence.
But is that also the product of people who are informed about health care and probably take good care of their...
I believe in this day and age there are a lot of families who do vaccinate but are informed about health care and do a lot of other things to promote health. And in fact, a good friend of ours, Dr. Mayer Eisenstein, who's a medical doctor, he's an obstetrician in the Chicago area, he does not promote the use of vaccines. And he has about 30,000 patients. There was a study that looking at his practice a few years back, he has virtually no cases of autism in 30,000 patients. Record low rates of asthma, allergies, and a lot of the things that plague American children today.
Do you have any concerns, Renee, about the number, because of the concern right now about Ebola in this country? Though there, of course, is no vaccine against Ebola. Do you have any concerns at all about that?
Actually, no. And there are a lot of people in our country that are alarmed, frightened, afraid. There are others that have predicted that we would have Ebola come up, especially seeing that our own National Institutes of Health has owned the patent on the Ebola vaccine since 2004. They started clinical trials in 2006. Our own CDC actually owns the patent on the Ebola virus since 2010. So there were a lot of people that were saying, you know, surely our government is not going to invest all of this money, resources, owning patents, creating vaccines if they didn't plan on administering the Ebola vaccine to all Americans. And so when it comes to vaccines, what I've observed is that there's only one thing that sells them, and it's not commercials, it's fear. And if you look at, for example, the huge swine flu H1N1 debacle that happened back in 2009, most Americans thought that a big portion of our population would be wiped out. And although nothing really happened as far as, you know, that goes, the CDC managed to sell an awful lot of vaccines. And so in my opinion, we're just getting geared up for Americans to be glad to add another vaccine to the vaccine schedule.
Well, you say nothing happened. I mean, quite a few people died.
Well, honestly, every year the CDC says that 36,000 people die from the flu. Actually, if you look at the own vital statistics, influenza takes a lot less lives than that. They usually combine it with pneumonia for the statistics. But that year, as I recall, less people than usual even died from the flu. So it was a less virulent flu season than any of the other years.
I won't challenge you on that. I don't remember the number. I do remember that year, but I don't remember that it was more or less. So there has been a recent increase of the number of measles cases in the country. Are you concerned about that? Those people who are not vaccinated and the exposure to measles?
I personally am not. Back in the 1940s, 50s, and 60s, measles was an everyday minor childhood illness. In fact, my mother was one of 11. She and all of her brothers and sisters had measles. It wasn't until there became a vaccine for measles that it became this life-threatening condition that we're all so scared of. But now, what you see if you study the outbreaks is that it's occurring in highly vaccinated populations. In fact, Dr. Pullen, he's a professor of medicine, and he's also the head of the Mayo Clinic, the clinic's vaccine research group. He came out with a paper in 2012, and the title of it was The Reemergence of Measles in Developed Countries. And he basically calls our whole measles program a complete failure, because what research is showing is that measles is happening in highly immunized societies, primarily among those who have already been previously vaccinated. So I believe that it's the vaccinated children that are propagating these outbreaks of measles, and that is what the evidence supports.
That the vaccinated children?
Absolutely, and if you look at every recent outbreak of the measles, you will find out that almost all of the children were fully vaccinated.
What do you believe will happen to your children, Renee? And Matthew, what do you believe will happen to your children if they were vaccinated?
I believe that their health would be exactly like every other American child's health. I believe they'd have recurrent infections, a challenged, compromised immune system, and asthma, diabetes, eczema, allergies, anaphylaxis, seizure disorder, developmental delay. That is sadly what happens to children who receive all the vaccines on the schedule, in my opinion.
Matthew, you agree?
I saw a young patient today, 3 months old, and every time she eats, she throws up. And certainly they had him vaccinated just a few weeks prior. And I don't call it any fluke, but none of my children have ever thrown up after they ate, whether it be through a bottle, through breast milk, or through table food.
In other words, one thing that vaccines are linked to is a high prevalence of gastrointestinal problems. And so now it's hard to find an infant that doesn't have reflux, constipation, colic, all sorts of problems that never previously occurred in infants.
Right, and then parents are so indoctrinated that that's normal that they have to burp every time. They have to...
I put them on Prilosec. That's what happens now in our pediatric society, is that infants are being raised on medications.
And so the prevalence of diseases such as chickenpox, measles, pertussis, those kinds of things that killed many children, 50 years ago, you believe that those things would not be affecting children today if there were not vaccines, polio.
Well, just so you know, there were some infectious illnesses for which a vaccine was never created. For example, scarlet fever. And also tuberculosis. There was never a vaccine for that utilized in our country. Scarlet fever is basically non-existent. The infectious illnesses that we still have today are the ones that everybody's being highly vaccinated for. I'm glad that you brought up pertussis, though, because, for example, just this year in 2014 in January, a study from the United States National Academy of Sciences, they did a primate study, and they found that primates vaccinated with the acellular pertussis didn't contract the full-blown disease, but they did become infected and transmitted the disease to their peers. And so they actually came out with a paper showing that the people, it can be assumed from the primate study, who are vaccinated against pertussis actually become a carrier and transmit the disease.
So that was from what study?
The United States National Academy of Sciences, January 2014. Here's another one you might like, out of the Oxford Journal. It's the only double-blind, placebo-controlled study on the flu vaccine that's ever been done. And they found out that those vaccinated with the vaccine against influenza had a 4-fold increase in the likelihood of developing a non-influenza upper respiratory infection, some of which were morbid in their studies. And so, interestingly enough, they also found that the influenza vaccine was about comparable to the placebo. So that study showed that not only is it non-effective, but it also, because of the way that it affects your immune system, makes you more likely to contract other conditions.
Do you think that the primary reason that researchers are promoting the use of vaccinations is driven by money?
I can't think of another reason, really. And even if you look at the trouble that Merck is in right now, there are 3 different federal lawsuits alleging that they falsified data, particularly with their mumps vaccine, that they knew in clinical trials that it was not going to be effective, and in any way they pushed it through, marketed it, and now we have these mumps outbreaks. Definitely the integrity and the ethics of pharmaceutical companies has been questioned and questioned over and over again. And they've been found to be unethical and, yes, driven by money. You mentioned polio. Would you like to talk about polio?
Sure.
Okay. So you'd asked me, how concerned I am about polio. That's also something that I'm not concerned about. Polio was a dire threat back when we didn't have proper sanitation, nutrition, or clean water. But really, since we have those things, polio is really only a concern for very compromised individuals. I read a statistic that since 1985, there's not been a single case of polio in the Western Hemisphere that was not related to the vaccine. So again, there's another link between the vaccine and becoming infected. However, aside from that, just talking about polio, research shows that 95% of individuals infected with polio are completely asymptomatic. So either of us could be sitting here right now infected with polio, 95% of the time we wouldn't even know it. Almost 5% more of people end up having flu-like symptoms, common cold symptoms, sore throat, headache, stiff neck, very often misdiagnosed for the common cold. Only in 1 case out of 1,000 does a person become affected by paralytic polio. And then at that, even if they are, very rarely is it permanent. And so this is just another example where the risk of the disease has been completely overstated, and the benefit of the vaccine has as well.
Having said all of that, you would have no concern of your child being exposed to someone who had polio or pertussis or any one of those other diseases that we've described, your child being exposed to them.
I would not. And that's why I can wake up and send my kids to school every day, because I know that they're surrounded by children that have received possibly 9 vaccines at the doctor's office the day before. And that might be one of these cases where they had a pertussis vaccine and now they're a carrier and transmitting. We focus on health, natural immunity, keeping our children's immune system strong, and no, I'm absolutely not frightened by these infectious illnesses.
And have your children had any, you said that they have not had any diseases or conditions or anything out of the ordinary?
Our oldest son did get the chickenpox last year in second grade. Nobody else that we even knew had the chickenpox, so I'm presuming it was from somebody who had been vaccinated with varicella in his class. Other than that, our children are phenomenal. They've never once had the need to be treated with antibiotics. They've never been hospitalized. They have none of the problems that their peers so commonly have. They do excellent in school, no behavior problems, no sleep problems. They're incredibly healthy.
Now, but my child, I can say the same thing, and she has been vaccinated. No behavior problems, no diseases, no disorders. I can say the same thing.
But you know what? Not many people can.
Right.
There
but
are
I think
far
that there
more.
are probably a lot of other people who can say that too, though.
Well, probably not 4 out of 4 kids.
I don't
Probably
know.
not 48 out of 48 unvaccinated family members. Probably not 38 out of 38 under the age of 16. And the one study that people on our side of the fence have been calling for years is for our government to conduct a proper study of the vaccinated versus the unvaccinated. That would put this whole debate to rest. And there are literally thousands of fully unvaccinated people in our country, so there is absolutely no reason why our government and the pharmaceutical companies should be so completely opposed to conducting that study. But I know that there's private funding, private groups are trying to raise the money to conduct a proper study of that fashion. And when that study comes out, I believe that it will really put this whole debate to rest.
You think that that will happen?
One day it has to. You know what? The rates of people that are opposed to vaccines it's growing dramatically. In California, in the Huffington Post, they were just talking about how the number of parents that opt out of vaccines in the past 7 years has completely doubled. In fact, according to their a study in pediatrics, the average parent that doesn't vaccinate is a white female above the age of 30 with at least one college degree, minimum income of $75,000. Finding that more and more affluent, educated, outspoken people in places of leadership are standing up against vaccines, and so this trend is not going to stop. There's no way that it's going to stop. And so I believe, yes, one day that study has to be done.
Currently in South Carolina, well, last year there were approximately 6,000 children in school who were not vaccinated. Are you surprised by that number? And that number is an increase from the previous year.
Not at all. I will see the numbers grow all over the country as time goes on. It's been a consistent trend. And if all of us parents of unvaccinated children were watching our kids get infected and die, trust me, we'd be changing our minds real quick. But the fact that unvaccinated children tend to be strong and healthy just adds to the fact that we believe we're making the right decision. You don't want to talk about autism at all, do you? Probably not.
No, not really.
Okay.
Because we're talking about
Okay.
vaccinations in general.
Oh, okay. All right.
Why did you
Another
want to
day.
make a comment?
Oh, I was going to say, well, this is an amazing opportunity because it's not very often that I've said that the news wants to hear our side of things, but something that is said over and over in the media is that the link between vaccines and autism has been completely disproven. For 20 years, our government has been stating that. And on the other hand, our vaccine court, our vaccine injury compensation program, has been compensating families of vaccine-injured kids with autism. In fact, there have been at least 83 cases that have been discovered when people have gone back and reviewed all these cases of compensation for vaccine injury. So I would say that debate is also far from being closed. That also in light of other studies linking vaccines to autism.
Really?
Absolutely. In fact, this is in the media right now. One of the 3 lawsuits that I mentioned that Merck is involved with is another whistleblower that came out. Are you familiar with the latest? Anyway, he worked for the CDC. He also worked with Merck on the MMR vaccine research 10 years ago. And he came out stating that he had cooperated and done away with information showing a 3 times increased risk for autism in African American boys as a result of the MMR vaccine. And so he just came out within the last month, and now this is another federal lawsuit because Merck has been found to have manipulated data.
Did you get any resistance from the school?
I received no
Okay.
resistance. I think parents that are less convicted about their beliefs might be more likely to receive resistance. But I know that here in the state of South Carolina, it's my state-given law to make vaccine decisions for my children, regardless of whether I want to do all, some, or none. And so it was as simple as filling out the proper paperwork, which is my signature on a page that comes from an exemption that comes from DHEC, and submitting it to the school. And that's basically the end of the discussion.
Was it a religious exemption?
Yes. It sure was. And one of actually...
And what does it state on that?
Really, since we have freedom of religion in this country, it basically states that for whatever religious beliefs that I believe, that we've chosen to exempt out of vaccines. I can give you a copy of that if you'd like.
Mm-hmm.
One of the religious issues that I'm most offended by is the use of human diploid cells in vaccines. In fact, this coming flu vaccine is going to be made with those rather than eggs, since there's such a high prevalence of egg allergy. So in addition to the aluminum, the thimerosal, the formaldehyde, the phenol, the acetone, the use of human diploid cells, which come from an aborted fetal cell line, I greatly object to that being injected into my children. So that was one of the deciding factors for why we signed a religious exemption.